So as promised, we're going to get into the different health recommendations. Now, what I want you to concentrate on are not the differences, but rather the similarities of what these things are. So these are the health recommendations of the American Medical Association, okay? Be more physically active. Adults should do at least 150 minutes a week of moderate intensity activity, or 75 minutes a week of vigorous intensity exercise. Make sure your family is up to date on their vaccines, including the annual influenza vaccine and the unspeakable thing they shan't be spoken of. I'm not going to debate anything. This is not a forum to be debating things like that. Okay, get screened. Estimates based on statistical models show that since April 2020, millions of screenings for breast, colorectal, and prostate cancer diagnoses may have been missed due to pandemic-related disruptions. Check with your physician to find out if you're due for preventative care tests or screenings. Know your blood pressure numbers, okay? And take necessary steps to get your blood pressure under control. Okay, so high blood pressure, also known as hypertension, needs to be under control. This will reduce your risk of a heart attack or stroke. Learn your risk of type 2 diabetes. Steps you take now can help prevent or delay the onset of type 2 diabetes. Manage stress. A good diet, sufficient sleep, at least 7.5 hours. I would recommend 8 or higher. And by the way, before I continue, I want to remind people I'm not a doctor of any kind, not a physician, not a DO, not an MD, not an ND, not a chiropractor, not a dietitian, not a nutritionist, not a physical therapist, not an LPN, not an RN, not a nurse practitioner, nothing like that. This video does not constitute health advice. So daily exercise and wellness activities such as yoga and meditation are key ingredients to maintaining and improving your mental health. Reduce your intake, I would say eliminate your intake of processed foods and sugar-sweetened beverages, especially those with added sodium and sugar. Eat less red meat and processed meats, and add more plant-based foods such as olive oil, nuts, and seeds to your diet. Also, reduce your consumption of sugar-sweetened beverages and drink more water instead. Drinking sugary beverages, even 100% fruit juices, is associated with higher all-cause mortality risk. If consuming alcohol, do so in moderation as defined by the U.S. Dietary Guidelines for Americans, up to 1 drink per day for women and 2 drinks per day for men. Okay, I would recommend don't drink anything. Talk with your doctor about tobacco and e-cigarette use or vaping and how to quit. Declare your home and car smoke and aerosol free to eliminate secondhand exposure. Follow your physician's instructions if prescribed pain medication or antibiotics. If you are taking prescription opioids or other medications, follow your doctor's instructions. Store them safely to prevent diversion or misuse, and properly dispose of any leftover medication. The AMA also encourages everyone who is eligible to visit healthcare.gov to sign up for health coverage. Blah, 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 blah. Okay, moving forward. Now, again, I want you to focus on the similarities and not the differences. Similarities, not the differences. This is the Mayo Clinic strategies to prevent heart disease. Okay? Don't smoke or use tobacco. Okay? Chemicals in tobacco damage the heart and blood vessels. Cigarette smoke reduces the oxygen in the blood, which increases blood pressure and heart rate because the heart has to work harder to supply enough oxygen to the body and brain. Get moving. Aim for at least 30 to 60 minutes of activity daily. Okay, 150 minutes a week of moderate aerobic exercise such as walking, 75 minutes a week of vigorous exercise, and 2 or more strength training sessions a week. That's what they want you to be doing. That's what you should be aiming for there. Eat a heart-healthy diet. Vegetables and fruits, beans or other legumes, lean meats and fish, low-fat or fat-free dairy foods, whole grains, healthy fats such as olive oil. Two examples of heart-healthy food plans include the dietary approaches to stop hypertension and the Mediterranean diet. Limit your intake of the following: salt, sugar, processed carbohydrates, alcohol, and saturated fat. Maintain a healthy weight. Being overweight, especially around the middle of the body, increases your risk of heart disease. Excess weight can lead to conditions that increase the chances of developing heart disease, including high blood pressure, high cholesterol, and type 2 diabetes. So if you're a man, 40 inches or more puts you at risk. And if you're a woman, 35 inches or more puts you at risk. Get good quality sleep. Most adults need at least 7 hours of sleep each night. Make sleep a priority in your life. Set a sleep schedule. Manage your stress. Some people cope with stress in unhealthy ways, such as overeating, drinking, or smoking. Finding alternatives to manage stress, such as physical activity, relaxation exercises, or meditation, can help improve your health. Get regular health screenings, blood pressure, cholesterol, type 2 diabetes screenings. Okay, now we're going to move on here. So now we have come to the creme de la creme. We have come to the Adventist 8 laws of health. Number 1, nutrition. Dangers of meat eating and dairy products. The following list of common complaints can be directly linked to the consumption of meat: impaired digestion, obesity, dermatitis, diarrhea, edema, acne, gas, and bloating. Body odor, dry scaly skin, constipation, allergies, bedwetting, fatigue, blah, 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 blah. Okay, you can read this on your own. Grains, it is much healthier to use whole grains, not refined ones. So never, in my opinion, you should never, ever be using any refined grains. Remember this little saying, the whiter the bread, the sooner you're dead? Sugar is not good for your stomach. It causes fermentation, blah, blah, blah. Free sugar has been shown to reduce the ability of white blood cells to function properly and to aggravate the heart. Okay, this is from the University of, I think it's the what is this? The University of Maryland, I believe, but, let's see here. Water. Drink at least 8 glasses of water a day. Many health problems would be eliminated, including bowel and bladder problems, anxiety attacks, and food tolerance reactions, burning in the stomach, headaches, colitis, pain, hot flashes, and many other problems if enough water were drank. Sunshine. So many have become afraid of the sun, thinking that they will get skin cancer from it. We believe that the sun does not, We believe that the sun does not cause skin cancer unless you are constantly out in it, burning yourself. But rather, it is a purifier. It brings to the surface, which is your skin, the cancers and toxins and germs that are already in your system. Okay, so temperance. Okay, so temperance is essentially self-control. So start to adopt a lifestyle of moderation, okay? Don't eat too much, don't drink too much, don't sleep too much, don't sleep too little, okay? Of course, okay, about 100 years ago, there was something called the Temperance Pledge. Okay, this is about, you want to abstain from alcohol, tobacco, and all addictive substances and things that would pervert the mind. Air. Breathe fresh, pure air. Do breathing exercises. Okay? Rest. Get proper rest. Don't overexert yourself. Trust in God. In my opinion, what I found is that it is more important not to believe that you are God, to understand your own limitations. To me, this has to do with handling stress. Okay? Recognizing that you have your own limitations. There's a limit to what you control and a limit to what you can do, and you have to live within your sphere of influence, inside that dynamic sphere. Moving forward. So what are the principles of natural hygiene? Eat food we were designed to eat. Sufficient nutrition. Healthy water and proper hydration. Strong enough sunshine. Restful sleep. Adequate relaxation. Appropriate amounts of non-injurious physical activity, meaning do comfortable exercise, like yoga, like gentle calisthenics, things like that. A comfortable environment. toxin stress and misinformation avoidance, positive social relationships. So keep this in mind. These are things that we can do. Now, take note of the similarities, not the differences, and implement as many of these as you can. Natural hygiene is the scientific application of the principles of nature to the preservation of health. Moving forward. So when we come back, I'm going to start talking about centenarians, okay? List of verified oldest people, list of centenarians by continent, American supercentenarians.